Welcome to another lecture by MedicoMedics, Learning Made Easy. Medical Terminology, Chapter 7, Pathological Conditions and Advances in Medical Terminology. In this lecture, we will discuss pathological terminology basics and continue on to advances in medical terminology, advances in telemedicine and technology, discuss terms related to public health and emerging diseases, do a practice and application run, and end with a summary. Now, this lecture will focus on pathological terminology, so words used to describe diseases, symptoms, and conditions. Further on, we will discuss advances in medical terminology, so new terms emerging from fields like genomics and telemedicine. Understanding these terms helps to accurately describe diseases and to stay updated with medical advancements. So, pathological terminology basics. Pathological terms describe symptoms, so patient-reported issues like pain or fatigue, etc. Signs, so observable or measurable issues like fever or a rash. Conditions, so disorders affecting body function like having diabetes or cancer. Common suffixes used in pathological terms then. We have itis, so inflammation, for example, arthritis. Osis, meaning abnormal condition, so, for example, cirrhosis, meaning liver damage. Algia, meaning pain, so neuralgia, nerve pain. Emia, blood condition, so anemia, meaning low red blood cells. Common pathological conditions. Examples include hypertension, high blood pressure, diabetes mellitus, disorders of blood sugar regulation, cystic fibrosis, a genetic condition affecting lungs and the pancreas. So cyst is cyst, ic meaning pertaining to, and then fibrosis meaning scarring. And finally, we have myocardial infarction, so heart attack. Myo is muscle, card comes from cardia, infarction means tissue death. So myocardial infarction, essentially heart attack. Now, what about disease progression terms? So words describing disease stages and effects include acute, meaning sudden onset. So if we say acute appendicitis, it's an acute, meaning sudden onset inflammation of the appendix, acute appendicitis. Chronic means long-term. So, for example, COPD, chronic obstructive pulmonary disease. If we use the term remission, we mean a disease or the disease symptoms are improving or disappearing. Exacerbation, meaning worsening of symptoms. So, for example, asthma exacerbation. Now, genomics has introduced new terms related to genes and personalized medicine. For example, the word genome, meaning complete set of DNA in an organism. Gene therapy, treatment targeting faulty genes. BRCA mutation, meaning genetic mutation increasing cancer risk. Pharmacogenomics, meaning using a patient's genes to tailor drug treatments. Advances in telemedicine and technology. So modern medical practice has added new terms like telehealth, which is remote health services using technology. Wearable devices, so gadgets like fitness trackers monitoring health, like your heart rate or your sleep, etc. AI in diagnostics, so artificial intelligence aiding in disease detection. Robotic surgery, so using robots to perform precise surgeries. Now, global health issues has also led to the introduction of new terms. For example, the word pandemic, meaning worldwide spread of a disease, became very popular during COVID-19. Epidemiology is the study of disease spread and control. The term variants, so there are mutations of viruses, for example, so we call it, one variant might be called the Delta variant. Zoonotic diseases, so diseases transmitted from animals to humans, for example, rabies. And now let's do some practice runs here. So decode these terms. Hyperglycemia. We have hyper, high, glyc, glucose, sugar, emia, blood condition. So hyperglycemia is high blood sugar. Bronchitis, bronchi, plus itis, inflammation, is inflammation of the bronchi. Telemedicine. Tele means distance. Medicine is medicine, so telemedicine becomes remote healthcare. Pharmacogenomics. Pharmaco is drugs, genomics is genes, so tailoring drugs based on genetics. So in summary then, pathological terms describe diseases, their symptoms, and progression. Advances in genomics and technology are expanding medical vocabulary. Staying updated with new terms is essential for effective healthcare communication. And that's the end of this lecture. Continue now to Chapter 8.